Hello, my name is Dr. Belal Abdallah, and I'm a board-certified internal medicine physician in Dearborn, Michigan. And the coronavirus is here in Michigan as of last night, March 10th, 2020. And I just want to give a few bits of advice to prevent the spread of this illness and what to do in case you are sick with respiratory or cold symptoms, and to help prevent the spread of this illness from yourself or from others. So currently, it's important to note that the coronavirus 2019 has no vaccine. So unfortunately, there is no way to prevent anyone from not contracting the infection once they're exposed to it. So the best way to prevent illness is to avoid being exposed to the virus. So the virus is spread mainly from person to person, that is between people who are in close contact with one another, that is if they are within 6 feet of each other, and through respiratory droplets produced when an infected person coughs or sneezes. So these droplets can land in the mouths or noses of people who are nearby, or possibly be inhaled directly into the lungs from the air if you are nearby someone who coughs or sneezes. The elderly people are at most risk for developing complications, as well as, and what I mean by elderly are those that are greater than 65 years old, and also anyone that has a chronic medical illness like chronic lung disease or heart disease. And that can be anything from congestive heart failure, asthma, emphysema, severe allergies with asthma. So the first thing I would say is I would recommend reaching out to your physician and asking for advice on what to do. But I will try to give you as much as I can on this video. So take steps to protect yourself. Number one, clean your hands often. That is, wash your hands often with soap and water for at least 20 seconds, especially after you've been in a public place or after blowing your nose, coughing, or sneezing. So if soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands when you rub them with a sanitizer until they feel dry. That's the proper way of using the hand sanitizer. Also, avoid touching your hands, nose, and mouth with unwashed hands. It's very difficult to avoid touching your face. You may think it's easy, but if you try, you will see that you may touch your face up to 100 times a day. However, with practice, you can avoid touching your face. If you get a little small itch on your face, I would recommend finding a napkin and using a napkin, if you have unwashed hands, using a napkin or Kleenex to scratch the area that you feel that you need to scratch. Number two, avoid close contact. So avoid close contact with people who are sick. Whether they have a regular cold right now, I would avoid close contact. Or if they have the severe symptoms or symptoms of the coronavirus. By the way, the symptoms of a coronavirus are a cough with shortness of breath and a fever. Those are right now the most common symptoms. Someone with sinus congestion or just congestion with low-grade fever may not have coronavirus, but again, because of this spread of the coronavirus, we have to maintain distance from anyone that is ill. Again, it's not to make anyone panic, but it's more these are things and ways to avoid getting sick. Now, you also want to take steps to protect others. So if you are sick and with the symptoms of the coronavirus, which are high fever, and by high fever, I mean a temperature of 101 or greater, and coughing and having some difficulty breathing, stay home. If you are not in the high risk category, meaning you're not older than 65 and you're not with chronic disease like lung disease or heart disease or diabetes, then the illness is low risk to you, and you'll probably recover within 3 to 5 days as you would with any other cold. However, if you're in that high risk category, I would recommend calling your physician and taking advice as to whether you need to be hospitalized or can you be treated at home. So if you are sick during this period, please stay home because we want to reduce. The best way to decrease the amount of complications from this coronavirus is to prevent the spread. And if you are sick, please cover, anytime you cough and sneeze, cover your mouth and nose with a tissue or use the inside of your elbow. If you do not have access to a Kleenex or tissue. So the inside of your elbow, like this. And again, if you do use the inside of your elbow, I know this is what we're taught as children and growing up, you may want to change your whatever you are wearing and get some tissue and keep with you, because that respiratory droplet on your elbow can infect others as well. And then when you do cough into a tissue and you throw it in the trash, or you cough into your elbow, recommendation is immediately wash your hands with soap and water for at least 20 seconds. And again, if soap and water are not readily available, then use a hand sanitizer that contains at least 60% alcohol. And wear a face mask if you're sick. So you should wear a face mask when you're around other people if you're sick, especially if you're sharing a room or sharing a car. And also wear a mask before you enter your doctor's office. If you're not able to wear a face mask, for example, because if you wear a face mask, it's going to give you difficulty breathing, then you should do your best to cover your coughs and sneezes. And people who are caring for you should wear a face mask if they enter your room. So again, if you're sick, wear a face mask. If you're not sick, we're going to get to that, but you don't have to wear a face mask. However, if you are not sick and caring for someone who is sick and that person cannot wear a face mask, then you should wear a face mask. If you're not sick, you don't need to wear a face mask unless, again, you are caring for someone who is sick and they're not able to wear a face mask because it's causing them to have even more difficulty with breathing. And the reason for having all these rules about face masks is, number one, there's a shortage of supply of face masks. So please, if you're not sick, do not go out and purchase face masks, and save them for those who are caring for sick people and those who are sick. And also for providers. Also, clean and disinfect. So clean and disinfect any frequently touched surface, and you should do that daily. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. If the surfaces are dirty, clean them. Use a detergent or soap and water prior to disinfection. So to disinfect, so after you clean them, then you want to disinfect. And the CDC gives us some guidelines on what disinfectant to use, or here are some options. Number one, you can use household bleach and make a bleach solution, and the mix you can either use 5 tablespoons of bleach and pour them into 1 gallon of water and mix and use as a disinfectant, or 4 teaspoons of bleach per quart of water. And then always follow the manufacturer's instructions for application and proper ventilation. And please, that's important, as bleach can also increase the troubles with difficulty breathing. And also always check that the bleach product you're using is not past its expiration date. And also never ever mix household bleach with ammonia or any other cleanser, only with water. And also unexpired household bleach will be effective against coronavirus when properly diluted. So again, unexpired household bleach is effective against coronavirus when properly diluted. Alcohol solutions, if you're using alcohol solutions to disinfect, they should be at least 70% alcohol. Again, you can go on the cdc.gov website and they will give you instructions and how to prevent illness. Thank you, and I will come back with any further updates.